Mycoplasma gallisepticum, MG. Infections are commonly known as chronic respiratory disease, CRD, of chickens and infectious sinusitis of turkeys. MG infections are economically significant due to decreased meat and egg production, increased condemnations, and increased costs of prevention and control. By light microscopy, MG stains well with Giemsa and appears polymorphic, coccoid or coccobacilli. Based on electron microscopy, organisms may show a filamentous or flask-shaped polarity of the cell body. MG grows in highly enriched protein-rich media, e.g. PPLO media, phrase media, and brain-heart infusion broth, or agar. It may be also isolated or propagated by yolk sac inoculation at 5 to 7 days of embryonating chicken eggs. Colonies are examined using a dissecting microscope and indirect light. Characteristic colonies appear as tiny, smooth, circular, translucent with dense central area, fried egg appearance. MG is fragile outside the host. Exudates and/or cold may protect it and can survive for a long time. It is affected by most disinfectants. Sunlight also inactivate MG. Mycoplasmas resist penicillin. Most outbreaks occur in chicken broilers 3 to 8 weeks of age and turkeys 8 to 15 weeks of age. Horizontal transmission occurs by direct or indirect contact of susceptible birds with clinical or subclinical infected birds. Vertical transmission of MG is known to occur in eggs laid by naturally infected hens, chickens, or turkeys. Incubation period is 1 to 3 weeks. Clinically, chickens infected with MG show tracheal rales, nasal discharge, and coughing. Feed consumption is reduced, and birds lose weight. In laying flocks, egg production declines. Severe outbreaks observed in broilers due to concurrent infections and environmental factors. Turkeys are more susceptible to MG than chickens, showing more severe clinical signs including sinusitis, respiratory distress. Typical swelling of the infraorbital sinuses resulting in partial to complete closure of the eyes. Feed consumption may remain near normal as long as the birds can see to eat. An encephalitic form of MG has been reported in 12 to 16 weeks old commercial meat turkeys displaying torticollis and opisthotonos. Morbidity is high, up 100%. Mortality is low, but may be increased in case of complications with other pathogens, up to 30%. Postmortem examination shows mucosal congestion and catarrhal exudate in nasal and paranasal passages, trachea, bronchi, and air sacs. Sinusitis with mucoid to caseous exudates specifically in turkeys. Air sacs frequently contain caseous exudate. In severe cases, there is caseous airsaculitis, fibrinous perihepatitis, and pericarditis. Oviducts distended with exudate, salpingitis, have been associated with decreased egg production in MG-infected flocks. Diagnosis depends on case history, clinical signs, and postmortem lesions. Confirmed diagnosis may be achieved by isolation and identification of MG. Differential diagnosis should be done with ND, IB, AI, fowl cholera, coryza, chlamydiosis, aspergillosis. Prevention and control of MG infection in breeder flocks is crucial to reduce vertical transmission to broilers. This may be achieved by infection mentoring and testing followed by eradication of positive flocks or by vaccination with live vaccines and periodical preventive medication with antimycoplasmal drugs. For broilers, biosecurity with preventive medication could reduce the economic losses due to MG infections. Egg treatment with antimycoplasmal drugs may be used to reduce vertical transmission, but it has many limitations.